Here once more with a quick programming note before we jump into the episode. And apologies if you've already heard this in episode 1 and 2, but we think it's important to mention that these episodes were recorded a few months before the coronavirus pandemic and the renewed national conversation around racial equity, police violence, and historical trauma sparked by the police killings of George Floyd and other Black Americans. So while the topics themselves feel more relevant and prescient than ever, you will probably notice that these important contextual factors of our present day are not referenced. So once again, thank you for listening, and on to the show. Welcome to episode 3 of Parenting in a New Context, Strategies for Practitioners Supporting Refugee and Immigrant Caregivers. It's a podcast made by and for mental health practitioners about serving refugee and immigrant families. Now, if you haven't listened to the first 2 episodes, it's not required, but it is encouraged. We've introduced the core concepts that we'll be building on in this conversation. And in particular, so far we've discussed the tenets of culturally responsive care and the ways that culture can influence parenting. So today we're going to build on that and discuss how trauma can impact parenting and the particular impact of trauma on refugee and immigrant caregivers. Once again, I'm Trevor Born with the Center for Resilient Families at the University of Minnesota, and today I'm joined by Alisa Miller, a research associate at the Refugee Trauma and Resilience Center at Boston Children's Hospital, as well as my current colleague and Alicia's former colleague, Saida Abdi, the former Associate Director of Community Relations at the Refugee Trauma and Resilience Center, and now current Assistant Professor of Social Work at the University of Minnesota. Thank you so much for joining me today, Saida and Alisa.
Thanks, Trevor. Happy to be here.
Now, in the first 2 episodes of this series, we've frequently used this phrase, refugee and immigrant caregivers. But, of course, those are different things. So to start, Alisa, could you just briefly talk about what you mean by those terms and how they differ?
Yeah, that would be great because definitions do matter. So essentially, refugees are people who have a well-founded fear of persecution because of their race, religion, or nationality and cannot return to their home country for fear of persecution. People gain official refugee status before they are invited to resettle in a new country like the United States. There are also people who identified as forcibly displaced migrants, and these are people who do not meet the legal status as refugees, but have fled their homelands due to dire conditions related to poverty, climate change, among other things. And there's also people who have fled their home country because of fear experiences, such as domestic violence or threat of harm by gangs or organized crime. Immigrants, on the other hand, are typically people who have voluntarily left their home country for better economic, educational, or other opportunities. And typically they have more resources than those who have been forced to flee.
And what's unique about the experience of trauma among people with this migration experience?
So regardless of how they got here, refugee and immigrant parents had to make the decision to leave everything they know behind for the hope of a better life for themselves and, importantly, their children. So despite differences in legal status, the terms, the labels that are used, these labels don't define a person's experience before and after migration. The factors that drove a parent to migrate can be complex. For refugee and immigrants who have left their home countries involuntarily, many have been exposed to potentially traumatizing events across each phase of migration. Those who migrated voluntarily may have also been exposed to potentially traumatic events. While refugee and immigrant parents do the jobs that other parents do, they're caregivers to their children, what is unique when we talk about them is that we need to hold the experience of migration and culture in mind, and we need to consider not only the culture of the parents we seek to help, but also understand our own culture as well as the culture of the mental health system here in the U.S.
Now, recognizing that, of course, every person has a unique history and path, what are some of the traumatic experiences that are common among people with this migration experience?
We think of the traumatic experience of refugees and immigrants to occur throughout the different phases of the migration. For example, in pre-migration, when refugees and immigrants are still in their country of birth or habitual residence, they are exposed to many types of trauma. They may experience direct exposure to witnessing of violence, including gender-based violence, torture, detention, death of close families, loss of spouses and children. For immigrants, they may actually have very similar experience of loss, of exposure to, for example, gender-based violence, to torture, to detention, as do refugees. An example I will give you is a refugee woman I worked with, a mother, who described how she carried her husband after he was killed for days in order to give. In addition, they face exploitation and violence from coyotes, who might be the people who are responsible for getting them here. For example, many of those refugees during migration describe walking for a long, long time without food. Mothers talk about giving birth and actually not having any medical care. I had one patient who talked about giving birth and having the stillbirth, and the child was still stuck in her, but she didn't get any medical care because there was none available. We often think that once people arrive here, they actually are safe, that they come to a place of safety. So for refugees, actually, no. In our research and work we do with refugees, we found that refugees, once they come here, face additional traumas, discrimination, community violence, cultural stress. Those traumas not only are faced by the parents, but also by the children as they arrive in the United States. Similarly, for immigrants, once they come here, they may face discrimination, like lack of protected status, for example, not having immigration status here, and the constant fear that they will be deported or that they will be separated from their children. Often parents and children will say, once we leave in the morning, we don't know if we'll see each other at night. Parents describe facing deportation, living in constant fear of being separated from their children and from their other loved ones.
Yeah, and I've heard you talk about, especially in this post-migration context, the importance of creating a sense of safety as a provider. Can you talk a little bit about that?
That's really an important idea to think about, because what we know about trauma is that at the heart of trauma is loss of safety. And to heal from trauma, the first thing we must do is establish safety. We cannot heal trauma without people feeling safe, that they are no longer under threat. And it is crucial to keep in mind the importance of safe haven in that sense of safety. That's represented by countries of asylum. So countries like the United States represent a place of safety, and what the loss of that sense of safety represents to refugees and immigrants. For many years, refugees and immigrants endure extensive suffering. They are often sustained by the idea of reaching a place of safety in the United States. I talked to many refugees who have been in refugee camps for decades, and they will say they woke up every morning in the refugee camp with one goal: reaching the United States and finding peace and prosperity that is promised by the idea of the United States. This provides them the strength to endure because they have hope. Once they get here, though, they expect everything to be normal. No more violence, good education for their children, plenty of food and housing, acceptance and inclusion. For refugees, the idea of arriving here and finding more violence, discrimination, and struggle to feed their children and support their children who are acculturating much faster than they are can be very traumatizing. And for immigrants like those who arrive in our southern borders, facing detention centers, separation of family members, and being demonized as criminals can create additional trauma and can lead to a sense of loss and hopelessness.
And of course, it's important to consider the trauma history of anyone we're serving, but what specifically should we think about when it comes to trauma and parenting?
I think importantly, for anybody who's working with somebody who has the potential experience of exposure to trauma, it's really important. Most people associate that with PTSD, but really fundamental to know and think about is that not all people who experience trauma go on to develop post-traumatic stress disorder, PTSD. Having been exposed to trauma does not mean PTSD or symptoms of traumatic stress. In fact, it's estimated that 15 to 40% of those who have been exposed to a trauma will develop a traumatic stress response. So exposure to traumatic events may result in PTSD, depression, anxiety, as well as symptoms of these like nightmares, irritability, being in a constant state of alert, as well as grief and complicated bereavement due to the loss of loved ones can also be potentially traumatizing. It doesn't mean that that's the experience of everyone. So overall, the news is good. People are resilient, and particularly refugee and immigrant parents who demonstrate this resiliency through their determination, strength, and strong sense of personal and family responsibility through making this migration journey, through reaching the goal of achieving a safe haven.
Well, I think I want to add something to this, that resilience is challenged and can be either supported or damaged by how we receive those refugees and immigrants once they arrive in safe haven, quote unquote, in a country of safety. For example, one refugee said to me, and this really stays with me, that even though this was many years ago, one refugee said to me, I worked so hard to get my children to America, to give them opportunities and education in the best country in the world. And now we're being attacked as terrorists. After America, what's left for us? Where do we go after the United States? This heart-wrenching comment points to the painful experiences of refugees and immigrant parents who saw the U.S. as a place of safety and opportunity for themselves and for their children, and who, confronted with discrimination and racism, are no longer sure this is the place they thought it was. And given what it's taken them to get here, they feel a sense of hopelessness and despair that's greater than anything they have ever experienced because they cannot see where to go from here. Children who watch their children going through that experience of despair and hopelessness may lose themselves, and they experience the same sense of loss and trauma because the parent is the mirror that tells children that you are safe.
Yeah, it's such a good example that you had, Saida. I think the example that Saida gave really highlights the flip side of resiliency. Both clinical work and research has shown us that when parents of children experience trauma, such as war, abuse, neglect, or natural disaster, that these events may negatively impact their parenting skills and the interaction with their children. Oftentimes, trauma exposure and traumatic stress crosses generations. This is what we call intergenerational transmission of trauma, and both parents and their children are affected. This is true for all parents and children, and particularly for refugee and immigrant children. It's been shown to be true across cultures and across socioeconomic status. We also know that it's common for parents and children to both have experienced trauma. So what has happened to a parent can change their parenting styles, how they set limits, keep their kids safe, think about discipline. It can change if, when, and how they ask for help, whether they find services helpful or just hoops to jump through. And importantly, it can change how much hope they feel that services will actually be helpful and how hard they will try before giving up on those services. So traumatic circumstances also create complicated shifts in family relationships and parental roles. And we know that refugee and immigrant parents often become disempowered through the process of migration. Ultimately, anytime parents are experiencing symptoms related to a traumatic experience, it will impact the way they parent and ultimately the outcomes for themselves and their children.
So if I'm a mental health provider seeking to serve parents with this experience, what are some ways I can adjust my approach knowing all this to be more effective?
I think this is such an important question. It's really important that mental health providers take into consideration parental trauma in caregivers' current behaviors, as well as the cultural values and childbearing goals of refugee and immigrant families. Often mental health services are created with Western lenses and without consideration of their utility to immigrant and refugee communities who arrive in host countries with their own values and beliefs. Parental trauma and parental cultural beliefs and values both impact child's symptoms and child's access to mental health services, as well as adherence to treatment. Providers working with a refugee or immigrant families must not only take the parents' trauma experience and cultural practice into consideration, but they must also practice a self-reflection and self-awareness that can help them consider how their own background can impact immigrant and refugee patients' access to mental health services. There are multiple things that providers can do. First and foremost, they can take a stance of cultural humility, being aware of their own biases and blind spots, and questioning their own assumptions about the experiences of these clients. They should be open to learn from the patients about the cultural expectations around care and the meaning making around these types of illnesses and what their own attributions of illness are. They should ask open-ended questions such as, please tell me what your understanding of your child's illness is. What do you call it in your language? Who do you go for help? What do they do when you go there? How is what this child is experiencing different than what your other children experience? What do you expect to achieve in seeking help? What has been your experience with care systems before? What has been helpful? What has been harmful? By asking these types of questions, the clinician can come to understand the parent's lens to the problem the child is having, and also the parent's expectations from the providers.
And it sounds like a lot of times the conflict can come when these, I guess, parental expectations and clinical understandings differ. Can you give a sort of a more concrete example of what that looks like?
Sure. So many of the refugee families that we've worked with see mental health symptoms such as a child's inability to self-regulate as behavioral issues. And they bring them to us as clinicians to help them manage their child's behaviors. So parents might actually be expecting that we as clinicians will criticize the child and tell the child to stop these behaviors. But as clinicians, we might consider this one of the worst things that we could do to a child who is struggling with psychological symptoms such as PTSD.
I think that's such a great point and tension. How do you think about how we avoid alienating the parent without re-traumatizing the child?
This is where understanding the cultural practices and framing the discussion around what's going on in a way that both engages the parent and creates empathy for the child is critical. It's so important. So, for example, in our work, we are fundamentally aware that parents who have experienced extensive trauma and loss often put a lot of hope in their child's success in school. That's why they came to the U.S. So these parents might be triggered when the schools call and say that the child isn't meeting their educational goals or getting in trouble. And the parents might either become angry at the school or the child. So by understanding what is driving the parent's reaction, so like in this case, additional fear of loss, that the child will not achieve the American dream that they fought so hard for, by understanding this, that can help us engage the parents around a deficit, not only around the deficit the child's struggling, but also around the strength. Like we want to help your child achieve the academic goals that you want for that child.
Providers also need to pay attention to linguistic and cultural barriers. For example, in many cultures, there might be no word for the trauma. So how do you translate that? How do you explain it? There's also the importance of role of stigma and also the confluency of mental health with religion and faith and spirituality. And how do we understand how people experience mental illness in that context? Also, the importance of framing of the impact of trauma and the need to build on the strengths of families and communities, not on the deficit as we hear about when you're working with the child. All of this really leads us to help parents to be parents, to care for their children, and not to disempower them, but to build on the strength that has brought them here, the resilience that they brought them with them, to make the experience of being here as parents is better and to help them achieve the outcomes that they will desire for their children.
Both of you are really involved also in research and development of trauma-informed interventions, around mental health for refugee and immigrant families. Can you take us out by sort of just describing some of the work you've done and generally the state of research in this field?
Sure. So there's been a lot of research that shows that newcomers, both adult and children, like refugee and immigrants, experience high rates of mental health issues that can affect their ability to resettle and experience success in their new home country, like the United States. It has also been shown that despite this need, mental health services are often underutilized. So at our center, the Refugee Trauma and Resilience Center at Boston Children's Hospital, we have been focused on developing trauma systems therapy for refugees, or TSTR. TSTR is a trauma-informed intervention for refugee and immigrant youth, and it was specifically designed to address the idea that mental health services aren't seen as helpful by refugee and immigrant families. By applying strategies to address the known barriers to care, such as distrust of authorities, powers and systems, stigma of mental health services, linguistic and cultural barriers, and the primacy of resettlement stressors. Paramount to TST is that we pair clinicians with cultural brokers in order to increase the acceptability of the treatment and also the ability to increase access of mental health services to families.
I think that, as Alisa said, TSTR is a model that looks at the core experiences of refugees, and specifically what really matches it very well with refugee experiences. And all that we've talked about is the idea that it looks at the child's symptoms, but it also looks at the importance of the social environment and the fact that we need to address the social environmental stressors that add to the child's symptoms. One of the things as I go around the country and actually around the world and train people on trauma and refugee trauma specifically, that always comes up is this idea of what are you doing with parents? And yes, and the need to do more parent-focused research and interventions. Mm-hmm. Because as we talked about how crucial parental mental health and parental healing is to a child's healing. And I think this is why we are so excited to be part of this work. And hopefully the next iteration of research and intervention is developed specifically to address refugee parental trauma and parenting here.
Yeah, and I would just add that, fortunately, this idea around looking at the life through a parent's lens and a parent's own experience of trauma and how that impacts parenting is being increasingly recognized, like Saida said, in clinical work, but also in research. And research is expanding and growing rapidly around these issues. So the future looks bright in that respect.
Absolutely.
Well, that's really what we're going to be digging into in our fourth and final episode, which is really looking at the specific ways that we can tailor parenting programs and interventions to be responsive to these types of cultural considerations. So please do tune into that. And as always, check out the show notes for links to learn more about the topics we've discussed. Please consider sharing this show with anybody you think might be interested. And most of all, thank you so much, Saida and Alisa, for your time and for highlighting these ways that we can address the kind of unique impacts of trauma on parents with a refugee or immigrant background.
Thank you, Trevor.
Thank you, Trevor.